and before you know it, get your jaw numbed up, and you'll end up having a root canal in that tooth rather than an extraction. And then you've just bought a whole new bag of worms, because 100% of root canal treated teeth are infected.
Wow. Is that true? Is that fact? Have you seen the evidence of is that really that worrisome?
Sure. No. The statistically speaking, probably one of the worst things you can do for your long-term health is to get a root canal, because it's usually done because the tooth is infected and painful. And so what do? They cut off the top of the tooth, roto-rooter out the pulp, so that you no longer have pain, but nothing is done for the infection. And this was documented by Dr. Huggins 25 years ago. He coordinated with dentists around the country to send Dr. Boyd Haley of the University of Kentucky, who set up a test to measure toxins inside teeth. And they had over 5,000 extracted root canals submitted to Dr. Haley over the course of a few years. And every one of them, 100%, had incredibly high potent toxins in them. And they did a few regular teeth that were extracted, let's say for orthodontic purposes, for adolescents that needed to get braces, or there was crowding of the tooth. So they tested some quote unquote normal extractions too, and there were no toxins. So this was present in 100% of over 5,000 consecutive extracted root canals. I think that's pretty safe to call it 100%. Maybe if there's one out there that's not infected, then you'll have 99.99999%. So that's not the type of odds anybody wants to play, that's saying, well, I think maybe my root canal's okay. And dentists that don't understand this or ascribe to this, they just say, well, if the tooth feels good and works fine, it's okay. Well, of course, we're not talking about cosmetics. Okay, we're talking about biology. We're talking about pathophysiology. We're talking about toxins being released into your bloodstream around the clock. When you have a root canal, or what's called an asymptomatic infected tooth, that's another thing that the cone beam detects, you have, unfortunately, a perfect system of disseminating pathogens and toxins throughout your body. Because what happens when you chew on a tooth like that? If you're chewing something hard, you generate some of the highest pressures that you can possibly imagine in any biological system between those two teeth. And what happens when you do that? You express the pathogens and the toxins in the lymphatic system and into the venous drainage. You actually inject pathogens and toxins more effectively into your system than with a needle in your vein. So it's just an incredibly, unfortunately, elegant system for disseminating these toxins.